In Guyana, more than 8,400 people are living with HIV and AIDS. The first case of HIV was diagnosed in 1987. By 1990, the country had the region's highest HIV prevalence rate of 2.5%. Non-governmental organizations, or NGOs, play a critical role in fighting HIV and other health and social problems. But their funding is dwindling, and they need ongoing support to stem the epidemic. The drive, passion, and commitment of individuals working through NGOs is a powerful resource that has shown remarkable results.
Our NGO partners actually account for 31% of the HIV testing that we did annually for last year. And so it clearly shows to us that NGOs do have a vital role, and that role must continue in terms of us reaching persons that we would not otherwise reach, because most of those 31% tests that were done was tests done to key population members who feel a lot more comfortable accessing the service at the NGO.
In 1999, a group of 9 NGOs started supporting the National HIV/AIDS response and formed themselves into the National Coordinating Committee, or NCC, to enhance collaboration among NGOs working in the HIV/AIDS arena. These NGOs delivered HIV prevention, care and support services among the general population throughout Guyana. At that time, stigma and discrimination was widespread, driven by fear and a lack of knowledge of the disease.
To watch people not wanting to come to an NGO because they're fearful that someone might think that they're HIV positive, to now watching people coming to get tested, coming with their partners and not being fearful, from the youngest to the oldest. I think for me that's a great achievement.
People are feared to be stigmatized. So they also are self-stigmatized because they feel if they go to a particular place, because maybe they had an intervention already where they feel stigmatized there, or somebody they knew was being stigmatized.
I was being tested HIV in 2009. My husband died and left me with all these 7 children, and I'm the only breadwinner in the family, so I couldn't stay to get myself deteriorate, so I had to learn. So my social worker, she started sending me to do different training. And then I said, you know something, I'm not gonna let HIV take me anywhere. I gotta fight HIV.
And so we have to work very hard within our agencies, within our organizations, within our home systems to bring ourselves to the point where persons are free of not feeling afraid or ashamed of bringing themselves to the point where they don't have to worry about talking about living with the disease, of being known as someone who's diagnosed with HIV, but to be comfortable enough to be at a point whereby they could freely talk about their HIV diagnosis and living with the disease without fear of discrimination or hindrance in some way or the other.
For us to reach our goal, we must have support. Everybody must work together to achieve the one goal.
In order to reshape perceptions of HIV and AIDS, the NGOs raised awareness of what HIV is and how Guyanese can protect themselves from contracting the virus. Care and support for those infected, as well as their family members, was also provided.
We need to have a more community-based response of the HIV epidemic. And it therefore means that the National AIDS Program Secretariat has to make its best effort to work very closely with our NGO partners in order to mobilize the response and increase the pace at which we get towards that goal.
Around 2007, this small group expanded to a network of 20 NGOs working in partnership with the Ministry of Health, private sector, national and international agencies, as well as local communities to reduce the transmission of HIV and ensure that persons who are affected can live a healthy life.
St. Francis have been able to incorporate HIV/AIDS activity into its everyday services, such as building houses for people, educating them, finding them jobs, getting lands for them, empowering them to help themselves, assisting their children to go to school.
By creating awareness and providing services related to HIV and AIDS, the NCC and its NGO members have helped people to know their status and get those who test positive on treatment. This has contributed to a reduction in the HIV transmission rate from 2.5% in 2000 to 1.2% in 2015. Today, NGOs are responsible for providing 25 to 50% of services to people living with HIV. With the reduction in donor funding in 2012 and recognizing the important role that NGOs play in national development, USAID implemented the Guyana Civil Society Leadership Project through the Volunteer Youth Corps, a local NGO. The aim of this initiative is to strengthen the National Coordinating Coalition, formerly the NGO Coordinating Committee for Sustainability.
So we're looking at the continuity, the survival of HIV prevention, education, reduction, and mitigation in the country. And so the organization has a team of experts who are providing these services to 34 major NGOs in Guyana, especially where there's not adequate health centers in community, especially those outlying areas where NGOs are based. Their services supplement what the government is offering.
One such initiative is edutainment, a blend of entertainment and education. This has been a powerful tool in the fight against HIV and AIDS by helping to create positive social change through the use of media and entertainment to educate, inform, and influence group interactions and individual behavior.
Each NGO, as we moved along, we recognize have different strengths. For instance, artists in direct support, their strength was in the arts. And so when we were working in low literate communities, we know that the arts would work well, and so we employed their expertise to do street theaters and so on.
So I think we've been able to change persons' perception of the disease itself and also how they look and how they interact and relate to persons with HIV.
The NCC has evolved and now has a membership of 36 NGOs that also respond to social issues directly related to HIV and AIDS, including suicide, gender-based violence, and child and human rights violations. Many of the NGOs have successfully implemented educational and social programs to curb these trends.
A lot of our work in sexual violence has been focused more on how we deal with the trauma and how we help children to cope, but we also need to look at the other health issues, and this is where we know that the membership within the NCC will help to grow that aspect of our work.
My husband tried to kill me like 3 times, strangle me, poison me, hold my mouth and throw the poison in. Well, actually I would get raped every night, so that's like a normal thing. Honestly, I didn't want to go home. Like I just feel like run away somewhere far and just leave the children and everything. Like I just got fed up with the pressure. And there was a lady under the shed from United Bricklayers, and she told me, she said, I have somewhere I can take you. Come with me. And they pray with me and they talk with me, and I share from the beginning to the end of my story. It was like a burden come off of me, like a weight. When I walked out of Bricklayers that day, I was a different person.
We've had a situation where the child was trying to tell the mom that she is being sexually abused by a family member. When she actually found out, by that time the child was HIV positive because the adult that was abusing the child was HIV positive. And so when we go into the schools to do sensitization, we talk to children about the other issues that can result from sexual violence, which would also include STIs and HIV and AIDS.
We like to encourage this kind of practice where NGOs and important persons in society get integrally involved in ensuring that we work collectively.
With minimal resources, NGOs continue to impact the lives of thousands of Guyanese. They complement the national response to health and social issues, and the need to sustain their services is pivotal.
Government has its work to do, Civil society, the private sector have all got their parts to play. But NGOs are particularly vital because of the reach. They reach the ordinary man.
Even in the face of dwindling financial resources, which threaten to limit the services provided by NGOs, these organizations have proved their ability to achieve much with little, but have a long way to go to achieve sustainability. The NCC welcomes your collaboration and support. Investing in these organizations is a smart way to invest in better health and more prosperous communities.